schools will remain open despite the COVID-19 numbers increasing rapidly. Basic Education Minister Angie Motshekga saying her department will do all it can to avoid an academic disaster. Here in Gauteng, about 20 schools have had to close since February. This is due to the virus. Joining me now is Dr. Daniel Israel. He is from the Gauteng General Practitioners Collaboration Group. Doctor, thank you very much for your time. Firstly, talk to us about the level of infection rates among children. I just wanted that to perhaps dominate our discussion for a little bit. What you are seeing now in terms of infection rates among children, is that alarming to you, or is it nothing out of the ordinary based on the previous waves we have come from?
Thanks for having me on the show. It's a completely different picture that we are seeing this wave compared to the previous waves. So much so that informed by specialists and, real academics across internationally, in the first and second wave, we weren't even checking kids. It was impossible that kids would have COVID, whereas now, in my own practice here, I'm seeing with my own eyes kids every day with COVID, and that goes for kids as young as 1 year old and up to matric and beyond. So it is alarming. I'm sure that you'll want to know, how badly are kids affected.
The severity.
So kids aren't always terribly affected, thankfully. We often have kids who just get cold and flu symptoms, but the real problem is that kids spread this COVID-19 and this third wave as much as adults. So I've seen index cases where a kid in the family will be the first person in the family to get the virus, and then parents and grandparents have caught it from the kids unknowingly, thinking that the kid just had a cold. So it is a very serious situation.
Your comments then, Doctor, on the back of the Education Minister's comments that schools are not going to be shut. However, individual cases are going to be attended to. And I suppose what that means is that with the 20 schools that have shut down, I guess that is the approach, that the more infections you see in a school, the recommendation might be that they shut down. That differentiated approach, do you think that's the way to go?
So I believe that when infection numbers are low, that's very doable. And I've worked on a couple of school teams myself where we've had isolated cases over the year that's been, and we have shut down a little sector, and we all know about those. But in the current situation, where there is an absolute uptake, especially in Gauteng, of cases, it's almost impossible to pick up who has this virus. And I don't think that it's practical and doable to be able to stop kids from going to school with COVID. Now, you could say, well, if all the measures are followed and masks are worn and hands are washed and windows are open, no one's going to spread it. But we've seen firsthand as doctors, and we've seen as parents, and that young kids don't understand the severity and what they need to do, and older kids in their teenage years are perhaps rebellious and don't do it anyway. So my feeling is, all of our feelings is, we absolutely commend the Department of Health for their progress in terms of really taking on this vaccine drive, but it's going to take time. And in the meantime, we have to safeguard lives. And it's important that in this peak, that schools should be closed, and that while things get under control and hospitals are emptied out, and then we can start implementing a gradual approach of opening schools, not the other way around.
Doc, I'm going to ask you to put your head on the block here. Should schools be closed in provinces that are seeing skyrocketing numbers like Gauteng, or are you saying schools throughout the country perhaps at this time, let's shut down?
So there should be a differentiated approach between different areas in the country, and in skyrocketed areas, schools should be closed. In very low provinces, schools can be monitored at the moment, or the numbers can be monitored. But as soon as there's an uptake, one has to preempt the explosion. Not close schools once there already is an explosion. And like our private schools, for example, some of them are going to have terms that are open now until August. I really believe it's irresponsible, in light of the fact that it will definitely take a long time for these vaccines to be rolled out to adults, to let schools be open until August because we're following measures. It's just not doable on a practical level at this point.
Final question, Doc. Teachers are being vaccinated, and that's the start today. Gauteng giving itself a deadline of 2 weeks. This includes both teachers in the public and private sector. In your calculated guess, with the delays that we've seen, that target of 2 weeks, do you think it'll be met? And I want you to incorporate into this answer whether once the teachers have been vaccinated, do you think it will be safe for schools to reopen because teachers would have been vaccinated, and these are people who I suppose would be immediately vulnerable as a result of kids becoming infected and passing this virus on?
So it's always easy to sit on the outside and to point inwards and say, no, this is wrong and that's wrong. But I think a fair, balanced and measured approach is to understand that the goals at the beginning with healthcare workers was to vaccinate all healthcare workers. And I remember the government saying this by the end of January. And we are now sitting in June and we still haven't vaccinated all healthcare workers. We've done well, but we haven't achieved it. So I think that the goals are really not reachable. They are commendable, but they are not reachable. Given that, I think that we should carry on with the program, but only once we've reached a critical mass of a percentage of teachers who have been vaccinated is it safe to send kids back. Now, to address the second part of your question, one has to understand that after there has been vaccination, one has to allow for an immunity time. So especially with a Pfizer vaccine, it's a longer process. With a Johnson & Johnson, perhaps shorter. But there's a good 3 to 4 weeks that one needs in order to build up an antibodies. So, it's not a question of just vaccinating and keeping kids at school. I'm not the Minister of Health, but if I was, I would say there needs to be an immediate shutdown. And then as the vaccination process rolls out, which hopefully will be better than what we expect, we will then graduate teachers back into school once we can see immunity levels are safer.
Very clear, not mincing your words at all. Dr. Daniel Israel, thank you very much for your time. He is from the Gauteng General Practitioners Collaboration, and his call is unmistakable. Close down right now, otherwise it is irresponsible for schools to remain open whilst we have the kind of numbers we are seeing.